If you think of our, population distribution, things are shifting. It's a change, and it's one that we need to face head on and think about. So that's part of the reason why it matters.
According to McGill University research, social factors can have an impact on how seniors age. Researchers looked into data from various studies conducted on aging populations around the world and found that greater social economic resources and stronger social connections were more likely than others to age in place, meaning how likely a person is able to grow old in their own home.
We really wanted to look at sort of the equity dimension of aging. And aging in place is something that is a widespread preference. The vast majority of older adults who talk to want to stay in their homes and in their communities as they age for as long as they can.
The research found that those living in rural communities and ethnic minorities were more likely to age within their community due to a lack of access to health care.
Aging in your home, is that home safe? Is that home allowing you to access services, or is the jurisdiction that you're in, the province or the city that you're in, providing you with enough services to meet your needs? And oftentimes those needs will be changing.
One thing that stood out to researchers as surprising was those with higher levels of education were less likely to age in place, meaning they were more likely to end up in a senior's home.
What we were interested in was finding out, is it something, in an ideal world, medical need, your medical context is really the only driver of whether or not you end up in a long-term care home. That is sort of the ideal. And what we found is that that's really not the case. A lot of these social dimensions that we think of as social determinants of health influence both how healthy you are across your lifespan, including later life, and your access to health care. So they influence whether or not you're able to stay at home.
These findings aim to develop policies, programs, and services which will help ensure that all older adults can remain in their homes for as long as they're able.
From a policy level, I think that there really is a huge opportunity for the system to step up. The Canadian population is aging rapidly. Quebec is one of the fastest aging populations in Canada, and we're going to need to be able to shift the healthcare system to deliver appropriate care to this population.
The next phase of this project will be to look at social inequalities in aging in place in Quebec specifically.
Factors that relate to your identity as a person can influence both your access to the healthcare system and your ability to age in place. And I'm hoping that that can empower people to seek and access the care that they need and know that it is their right to have that care.
In Montreal, Tehosterihens Deer, City News.